So is heroin the next drug epidemic in America? Joining me now is Carl Hart. He's an associate professor of psychiatry at Columbia University. He's also the author of High Price, a book that looks critically at drug policies in the U.S. All right, so looking at those kids that we just saw on Long Island, why would anyone decide to start thinking about even trying it once when we've heard some folks who profess to be experts on this topic will say, you try it once and you will be hooked?
It's difficult for me to stop laughing at. That is quackery. There's nothing in life that you try once and you are hooked. Addiction, by definition, means that it requires work. Remember, back in the 1980s, 1986, 1985, 1987, we were saying the same thing about crack cocaine. Try it once and you're addicted. And the hysteria surrounding crack cocaine was kind of similar to what's starting to happen now with this heroin sort of thing. And we passed some bad policies, and a number of people's lives were ruined, not so much by the drug, but by the policies and the hysteria. And so one of the things that I'm trying to make sure we do is that we understand what's real, what's reality, and what's just hysteria.
So what in the real category, is it real to you that it is an addicting drug?
Sure, alcohol is an addicting drug. Tobacco, marijuana, all of these things can be an addicting drug. Oh, absolutely, it certainly can be.
So in the real category, or maybe false category in your view, is it the case? We heard some theories from some experts who say, you start using heroin, you are not going to see 50.
Again, I don't know where you all get those experts from, but whoever says that, perhaps maybe you shouldn't call them an expert. That's just simply not true. If you look let's just look in the United States, the number of people who have been treated for heroin or what have you, we have a number of people who are on methadone maintenance who are past 50 in this country. When you go to Switzerland, a place where they actually prescribe heroin to heroin addicts to help them deal with their problem, they have people there who range from the age of 21 to 75.
So then, based on your expertise, what's the best way, or I guess, are there a set of best ways that you think this problem of heroin use, whether it be the age of 12 or 21 or 31 or 41, how do you tackle it?
First of all, if you have a child, like you all kind of showed in this clip beforehand, if you have a child at 12, 14, 16 doing heroin, you have bigger problems than heroin. People still have to parent. That's related to parenting. That's not so much a heroin problem. That's a parenting problem. So we need to make sure we don't conflate bad parenting or parental issues.
But then how do you help that 12-year-old? Okay, bad parenting, whatever it is, but then how do you reach that 12-year-old?
First of all, I need to know a lot more about that 12-year-old. But I assure you that if a 12-year-old is using heroin, heroin is not that person's problem. So when you say, how do you help that person, I need to have a lot more information. So if somebody tells you some simple response to how you deal with that 12-year-old's heroin problem, and they focus on heroin, you have before you somebody who is probably a quack.
Do you have worries that the energies are not being placed in the right areas to tackle, to stem the problem?
Yes, I do. Particularly when we think about why people are dying from heroin-related deaths in this country. The vast majority of them die because they combine the drug with another sedative like alcohol or benzodiazepine. 75% of the people. So you want to make sure people are not combining heroin with another sedative. That's one. Okay. Another sort of concern I have is that we need to make more available this heroin antagonist, or this drug that blocks heroin's effects, naloxone. If people have that available to them, they can inject that, and then it reverses the effects of heroin.
All right.
85% of the people who die from heroin-related deaths do so in the presence of someone else. And if that someone else could administer this drug that blocks heroin's effect.
All right, we'll have to leave it there. Dr. Carl Hart, thanks so much. I know there's so much. That's just the tip of the iceberg. I know this conversation can continue. Thanks so much. Appreciate it.
Thank you for having me.